There are indications that South Africa has entered the peak of the COVID-19 pandemic, but a peak in the virus doesn't mean that it's necessarily over. All over the world, people are camping against lockdown regulations. But what does the future hold? We're joined by Dr. Richard Lessells, an infectious disease specialist from KRISP, which is the KwaZulu-Natal Research, Innovation and Sequencing Platform. Dr. Lessells, good evening and thank you so much for your time on News at Prime. Firstly, there are big conversations taking place globally about whether or not the strain of COVID-19 that we're dealing with now is a less potent version of the virus than was first experienced. What is the consensus on this matter? Well, not that we can ever have full consensus in the scientific world.
Yeah, good evening, and good evening to your viewers. So there's no evidence at the moment that the virus itself is changing significantly, either in terms of how easily it spreads between people or in the kind of form of disease it causes in the human. There were some reports a little while back from Italy that people were suggesting that they were seeing a less severe form of the disease. But I think the evidence suggests that that was not an accurate representation of what was happening. And we, certainly in South Africa and around the world, we're tracking the virus very closely and tracking the genetic code of the virus, something that we're heavily involved with here at KRISP and other labs. And we haven't yet seen any change in the genetic code that suggests that the virus would be behaving particularly differently as it moves around the global population. So I think the consensus is at the moment there's nothing to suggest the virus is becoming less potent.
Part of what we've been told to expect as those who, of course, will be experiencing COVID-19 is that we should avoid or delay the peak as long as possible. But the suggestion is also that once it has peaked, then we're out of danger, we're out of the woods. Is that the case?
Unfortunately not, and I think that you're seeing now around the world that's being illustrated, that unfortunately as you come over that first peak, if you drop your guard and you relax too quickly, you're going to see a much more significant rise in cases and peak. And I think that we're seeing that in a number of places. I guess most starkly in the United States, but also seeing it in other countries like Israel, like Japan, like Australia, where they're seeing now a more significant rise in the epidemic.
Sure. Go ahead.
No, I'm saying I am a little bit worried here in South Africa that the talk has kind of come to the peak and that we're over the worst of this, and I'm really worried about the message that kind of sends, that we can all start relaxing. And I think it's absolutely not the time to be sending that message out. We need to really keep strong and keep our guard up and keep following all the government recommendations and regulations.
Does that partly explain the situation of a province like the Western Cape, where the number of infections seem to have stagnated, at least of people who are being tested, and the capacity of the hospitals also seems to have somewhat eased over the last couple of weeks? But many are still asking themselves whether or not this means that the Western Cape is now going, if it has in fact gone through its peak, and that, they're through the worst of this.
Yeah, exactly. I mean, these are all good questions, and I think, like you say, every day we're looking for optimistic news, positive news, and there clearly are these positive signs from the Western Cape, like you say, but still, with quite a restricted testing policy, they're still reporting 800, 1,000 new cases every day in the province, and that still suggests that there's pretty high levels of transmission of the virus in the province. So as I said, it wouldn't take much. It wouldn't take much for that to really accelerate again. And so we really must stay strong and kind of consistently see these decreases in cases to suggest that we're really turning off the transmission.
So,
and then on that, we've got to stay strong.
What does this mean in the long run, right? Because many people are thinking, let's look at the school calendar, for instance. You know, we've had the union say, we'll come back to work after this peak, which is sometime in September. So if the general consensus is that there is no such thing as getting over the peak or getting through the storm, that fundamentally changes how we need to be approaching COVID-19 even now, and perhaps being realistic about how long many of the measures that we're having to implement in this moment we're probably going to have to keep doing until there's a vaccine.
Well, I think that's the reality, and I think you've heard Prof. Abdul Karim and other leaders talk about how we have to learn to live with the virus. And we're learning here in South Africa. We're also learning from other countries. And you may have heard from the United Kingdom over the weekend, their kind of chief scientific advisors, medical advisors, talking about how they were starting to see an increase again, and that to them that was signifying where the kind of limit of the easing the restrictions is, because they've done it very gradually now. And so they're seeing, as cases are rising now, that may be the limit of where we get to. And we have to therefore make decisions as society and what our priorities are. And I think that there's general agreement that schools reopening is an absolute priority, not just here, but around the world. And we have to work out the best way to reduce the transmission in the community, such that reopening of schools is as safe as it can be. So we have these difficult decisions as to what are the priorities in the country, both for the economy and for our lives, and we have to then build the strategy around those priorities.